Hi Vaishali, welcome to LTW's Chatroom. We're so happy to have you here with us.
Hi Akshi, thanks for having me here. It's really a pleasure to be a part of this.
So tell us something about yourself.
I'm into skin aesthetics. I have a clinic here by the name of Glow and Go. It's situated in C Scheme.
Okay, so also you've just become a new mom. So how do you feel about that and balancing work and motherhood? How are you doing that?
I would say it's not at all easy. I mean, I remember the first day I was going to my work and the amount of guilt I had leaving my child behind. It was crazy, but it's like a constant battle in your head where you feel that okay, your child is fine, you need to do this. I mean, it's really difficult to become yourself
and manage two
and
babies,
manage.
right?
Yeah,
it's like your work is your baby as well.
Yeah,
managing it.
and your head is just occupied with your baby. I mean, what is he up to? What is happening with the baby? Though you know there's help to take care of the baby, but still it's not easy.
Totally, I can understand all of this. So now, if I had to ask you, then how would you explain skin aesthetics to a common man?
I would say it's like getting any cosmetic procedure which usually involves your facial skin, body as well, but usually people are more concerned about their face aesthetics. It's what you see superficially. Like there could be pigmentation, there could be acne, there could be unwanted hair, wrinkles. So all these are part of skin aesthetics. Skin aesthetics, again, people think, oh, is there any surgery involved in this? So there are two terms if you've heard about invasive and non-invasive.
Okay.
So invasive is something where there's a surgery involved, where we break down the skin. And we are into non-invasive things. So non-invasive is usually, it's done by lasers or maybe Botox or fillers, which is very minimal invasive, where you just need to prick the skin like it's an injectable.
So there's no you're not like cutting through.
Not like breaking down the skin. There's no blood. There's no.
And it's not a painful procedure.
Not at all.
Could you explain us the difference between Botox and fillers?
Good question, I would say, because these days people are getting into fillers and Botox. The taboo of anti-aging and the home remedies, this is all declining now. Yeah. So to a layman, I would say Botox is done to get rid of your wrinkles, and fillers are something to add volume or give structure to your face.
Like
plumpness, like whatever wrinkles you see, it's usually around the eyes or the forehead. If you'll
your smile lines.
Yeah, if you'll just throw a big smile right now. So if you could see, these are called crow feet. So these we remove through the Botox thing. And also Botox does not necessarily is going to erase everything. We don't want to achieve the plastic look also. We're going to minimally do it so it looks very natural and you can look the younger self.
Any age, like if you're say like 30 to 40, go for fillers, or any age barrier?
I would say even a 2-year-old child can go through Botox as a medicinal thing, because if you've heard about people who have squint eye, they also use Botox to treat that. So there are many, Botox has been working as a medicinal science. It's just not for the beauty. And also we are just trying to paralyze the nerve, and then through that we are able to achieve the desired outcome.
So there's no age for such
There's no age. It's a very personal choice, I would say.
So I've heard a lot about these lip injections and lip fillers. What exactly do they do?
So lip fillers, of course, everybody wants plum lips, and everybody, it's the new Kardashian thing that people are following since ages now. So I would say that's also a very personal approach, where we just fill few units of the lip filler and give you that vertical lift or the plumpness you're looking for. But I would again say for fillers or Botox, it depends on the person you're going to, because you have to match their perspective in a way. It shouldn't be too much or too artificial. It has to also look very subtle and natural.
Yeah, like, how we're seeing a lot these days that celebrities are getting some procedure done and then bol rahe teda hai, or they're not able to give those expressions. It's very plasticky. So what's the reason behind that?
The reason is because we are using too many syringes. We are using too many units on the face. So that will make you plastic. That will make you look plastic, of course. So it depends on who you're going for your counseling, who you're going for your injections to, because it's a very trustable approach where you need to trust your practitioners in a way, okay, he or she is not going to make me look plastic.
And is there like, how do you maintain? Suppose मैंने अभी करवा लिया, and how do I maintain?
I would say you just have to go for your fillers once in 10 months.
Okay, so that's
Once in 10 months to 12 months, depending on the area we are using. And for Botox, I would say 4 to 6 months.
So it's just that you kind of, so घर पे बैठ के, if I'm home, like how do I maintain it?
No, you don't have to do anything. Suppose we have done the procedure today. It takes about half an hour to just finish the procedure. There's no downtime. There's nothing as such that you have to be cautious about. It just, you have to be upright for the next 4 hours and few more precautions that will guide you.
Nothing ki, you have to start using these specific products or anything.
See, products, I would say skincare regime, it's a altogether different ball game. You don't have to compare both the things. Like, okay, necessarily just because you're getting a treatment done, then you have to go for a skincare.
You don't have to.
No, any which way the skincare is needed. Like how we take our meals on time, how we, maintain a lifestyle. I would say skincare is also, and it should be your lifestyle. It should be a part of your lifestyle. It shouldn't be, now people are in this stigma where they feel ki, oh my god, this Korean beauty, 17 steps, this beauty.
That was going to be my next question. So what is your take on this Korean beauty?
I would say Indian skin is totally different from a Korean skin or a Caucasian skin. In Jaipur, I also get to see a lot of Caucasian skin because there's a lot of foreigners who travel across the globe and come to Jaipur. So I would say the melanin, what we have in Indian skin is very different to the Korean skin as well. The Korean skin is already that glass skin that we see. I mean, the pores, their skin also has pores, but not like how Indian skin has, And they follow the 17 steps because they are more towards the natural remedies, the sun and the environment over there. They follow it according to their environment.
So you will not suggest?
I would say few things in Korean beauty, few brands.
Like say, if you had to give me, if I ask you, suggest me one Korean product, what would it be?
I would not want to say any Korean brand as per se.
A product, like a toner or a Korean sunscreens are good, or what else?
I don't want to like...
these we see a lot of reels and the snail mucin thing that people are using. Is it?
A lot of like rice water and lot of things, but few things are okay, but I would say skincare is very personalized to anybody. It's very individual approach thing. For you it will be very different, for me also it will be different. So as a normal person, you need to take care of few basic things that you should.
Also, weather is very different.
Weather is also different, and season wise you also need to change your skincare. So I would say a 20-year-old whose lifestyle is different from the other 20-year-old also has to have and maintain two different kind of skin regimes.
So now we're talking about age. So a lot of young girls, like say as young as 13, 14 are getting into skincare.
Yeah, a lot of teenagers.
Using serums and niacinamide and hyaluronic acid and retinol also I hear a few young girls using it. What's your take on that?
I would again say go to a professional person who's gonna check your skin type, who's gonna relate to your concern for skin and then guide you with what exactly you have to do. But I would say don't go and just blindly follow with the Instagram or whatever social media trend you're going and seeing out there.
A lot of reels are also circulating, skincare routine under a budget, under 500, under 200. Do you think one should follow it blindly?
See, at Glow and Go, and my personal approach to skin aesthetics, where I personally believe that quality over quantity. I'm not gonna ask you to use like thousand of things or even 10 steps. If I feel only 2 things are needed for you, you just go with that. But you have to also work on the quality science, because the ingredients that's been used on skincare is really like that matters. It's crucial for you to understand the ingredients and the quality of skincare that you use.
Yeah, so because
you just don't have to follow just for the brand, say, oh, this brand I've heard. No, it could be like you can also work with a 200 rupee cream that can also suit you. Even a 5,000 skincare can also work for you. So it depends on your lifestyle and everything, hands on hand.
And there are a lot of people who have cleared their skin themselves and trying to be influencers and putting content out there. Should we follow them?
I mean, it's a vast subject to say. I mean, few people are actually out there who are giving the right advice, but again, it's according to their individual skin.
So it happened with me. I followed someone and I got this product and I started using it, and my underarms were miserable. I had to go see a doctor for that.
Exactly. So I will actually give this advice to everybody: go see a professional. And then start your skincare journey, because it's not something that you should experiment on, because I mean, your skin is 70% part of your body, and you should actually take care of it, and it should be a part of your lifestyle, not something that we are forcing out.
So if you had to, if I had to ask you that one skincare product, regardless the gender or age,
I would say hands down sunscreen. Sunscreen is something that's really the magical thing that's been protecting people from pigmentation or anti-aging, or say everything. So no matter what, I would say two things: one for the day and one for the night. For the day, I would say sunscreen should be your best friend, no matter your age. I would say I have my baby who's 3 months right now, and I'm gonna make sure from 6 months of his age he's gonna start using sunscreen for sure.
So it's that safe.
It's that safe. Okay. Yeah. And for night time, I would say double cleansing. Since you asked me about the Korean skincare, so double cleansing started from the Korean skincare regime, and double cleansing actually is a game changer.
If you do, tell us more about it.
So double cleansing is where you double cleanse your skin when you take your day off. So one is with the oil cleanser, or with the micellar water, or whether anything to take off your makeup or your sunscreen.
Makeup balm or anything.
Yeah. And the second cleanse will be your cleanser or the face wash, a gel-based thing. So that's for a precisely thorough clean.
And then you just put on your moisturizer.
Yeah.
Okay. Also, could you tell us the difference, now that we're talking about skin aesthetics, we're talking going to a professional, the difference between a dermat and a cosmetologist?
So I would say a derm is somebody who's treating your diseases as well, like your allergies and skin diseases, whatever you have. A skin aesthetics or a cosmetologist is just going to work on the aesthetic part, the cosmetic procedures. So if you're going to come to me with an allergy or something, I'm going to send them to a dermat. So I have a dermat on board as well, but we don't treat the skin diseases. We are just into cosmetic and cosmetic procedures.
So tell us more about Go and Glow. Like, what are the what procedures are you guys providing, and what services are you providing?
So Glow and Go is totally into aesthetics. It could be any kind of lasers. Very common lasers these days are the carbon peel or laser hair reduction. Then you can come to us for fillers, Botox. There's hydrofacial. There's photofacial, which is done through LED lights. There are soft gel peels.
Which is the most popular or the trending facial?
Facial, I would say hydrofacial has taken over in Indian market since very long, and I would say all my clients, they love it.
Could you elaborate more on this?
So basically, hydrofacial is just we use different devices to make sure all the dead skin is taken off, and we put some hydration and hydrating machines to make the skin feel better.
For the plumpness only?
Not for the plumpness, I would say to get rid of the dead skin what you have. It's like a day-to-day thing, like
And how often should we get this?
I think 30 to 45 days is ideal to get a hydrofacial. There's fire and ice facial too. I mean, there's lot many facials. It's all bespoke according to what your skin needs.
A lot of brides these days are going for this, no? I think they are ditching the traditional salon or gold facials and diamond facials, and they're getting this done.
Yes. So again, I would say to all the bride-to-bes, you need at least 6 months of time to come and see any professional and work on your aesthetics, because it's not like a magical thing with one procedure, or you're gonna get the achievable or desirable thing you're looking for. It's not like the
No, but yeah.
So if you've heard about the IV drips, So beauty is also inside and out. It's not like just superficially, oh, you're applying so many things and your internal health is disturbed, because that's also going to show on your face. So I would say IV drips are something that really is trending, and people are understanding that how the nutrition in your body is also correlated to your skin. Like a vitamin D3 deficiency and a vitamin B12 deficiency could also give you pigmentation and a lot of other issues. If you have insulin thing going on with your body, so that can also lead to undesirable darkness,
hormonal
imbalance too. So I would say it's all 50% inside out, 50%. It goes hands on hand that way.
So what is the most popular procedure at home?
Popular, I would say, you'll be shocked to know this, but all my clients love the Botox and fillers what we do for enhancement of their beauty.
So you've been in this industry for 7 years. So do you see a change in people? Like now, are people more comfortable with fillers and Botox?
I would say no. I would say in Jaipur still people are in the taboo of, oh, I don't want to get injectables. Oh, it's gonna hurt. Oh, it'll dislocate my jawline, or all those myths. I mean,
are these procedures reversible?
Reversible as in, again, if I've done a filler for you and if you feel that it's looking little too much, then we can of course do a high lace to undo that thing. But again, I as I told you earlier, that it depends on the person you're going to. So there's a lot of discussion that we do, the trust factor. There's a lot of discussion, there's a lot of counseling that I'm gonna tell you and guide you through, that what's the outcome is going to be like. It's not like I'm going to promise you some certain things that's not desirable. So also it depends on the approach, where I'm going to tell you that okay, this is the outcome and this is how we're going to do this.
Okay. So if you had to describe Jaipur as a market for skin aesthetics, what do you think
I would
of
say this is still a very raw and untapped market, where aesthetics I would say aesthetics is still growing, and people are I would want to share one incident where I just met a client and she was like, don't tell this to my husband or anybody in Jaipur that I'm getting all these done. So I was like, why? So she told me that people are going to judge me, that, oh, I go for cosmetic procedures and stuff like that. So I think still people are not aware about these things, that, okay, these are very normal and basic lifestyle changes that you should do, like how in Bombay and Delhi people are getting all these things done. I mean, we still need to put a lot of awareness.
We need more awareness here regarding these procedures. People are still living in that taboo, like nahi karna chahiye, natural beauty is the best.
So a lot of people come to me that, oh, we've just come to inquire, we read this, we read that. So again, I would say, until and unless you come try something, experience it yourself, you can't rely on things that's going to work for you.
Yeah, because I think in other metro cities, this has become very normal.
Yeah, and also I would say my target audience is also somebody who goes to Bombay and Delhi to get the procedures done. Okay. I mean, so they don't have to go to Bombay and Delhi there every then and there. They can come to Glow and Go and get the things.
So how did your journey with skincare aesthetics started?
I mean, I would say I was destined for this somehow, and I was the franchise owner for Skin Lab. If you have heard about Dr. Jamna Pai, it's from Bombay. She's the pioneer for skin aesthetics in India. She was my associate partner for 5 years. I had a clinic in my hometown, that's Raipur. And I got married, moved to Jaipur, and I started my own brand by the name of Glow and Go here. So this is my 7th year of practice into skin aesthetics.
And Glow and Glow is how many years old now?
It's just 1 year. Okay. It's just 1 year old. So what I observed about Jaipur is people here, maybe the dentists who are doing skin aesthetics together, or so my R&D and that put me in that radar where I wanted to start the skincare journey for people. And also I have a team where there's a lot of medical people around me, like I have a dermat on board, there's a medical cosmetologist on board with me, I'm a non-medical cosmetologist, but so I only counsel and consult. Procedures are all done by my.
So you are not doing the procedures?
I don't do the procedures because there's a dermat who's doing all the procedures or the therapist who's doing the facial. So I have a team who's doing everything.
Okay.
Yeah.
So we hear a lot of...
I mean, I do few procedures like maybe a derma needling or something like that. That all I do. But mostly I have a team who does all the procedures, and it's my expertise and all these years what I've earned and gained with my background.
Okay, so can you tell us more about fillers? We've been hearing a lot about...
So fillers, I would say, if you want to add on volume or structure to your face, then of course fillers are your thing. And it's made out of a very natural sugar molecule, that's hyaluronic acid.
Which so we put serum
Yeah.
Oh.
So it's very natural. People have this myth where they feel, oh, what if I'm gonna undergo these treatments and years later I'm gonna look like, oh, what have I done to myself? It's not like that. No.
So it's just basically injecting hyaluronic acids and other things in your
your skin, and that lasts you for like 8 months to 12 months, depends on the area we have injected. And you're just naturally trying to enhance your natural beauty. It's not like you're going through any surgery.
So what's the most like popular area for us to get fillers?
I would say lip fillers these days has taken over. Everybody wants that plumpness, the vertical lift. So lip filler is something. And the cheek, I mean the cheek, the chin, people are going crazy for that.
It's all fillers, not Botox.
Botox is done to erase your wrinkles basically. It's not done for the volume part.
Okay, so even these the
crow feet and all, we go through Botox for that.
And here,
Botox, I would say in a very layman's language, like usually the upper face we treat that with Botox, and the lower face people generally go for the structure and volume. So we prefer fillers for that. So the cheekbones, the lip, the chin.
So Botox and fillers have nothing to do with the nose? Or
I mean, nose augmentation.
Only, right? It's a surgical procedure.
No, we can do Botox for your nostrils also. I mean, we can do so much.
With the nostril?
Yeah.
So how would Botox help in terms of getting a proper nose?
So nose, I would say we can inject few units here to get the bridge little corrected, or the nostrils, the flare of the nostril to look a little more slightly more sharper. So we can go like that.
Any age?
Even the lower face masseter bone, people want a good jawline structure, so we can go for a masseter Botox for that.
Any specific age for this, or?
I mean, there's no age as such, of course, plus 18, I mean, post 18 years. And I would say it's something that once you start these procedures, there's no going back, because you have already achieved the best version of yourself. So you would always want to enhance that. You don't want to get back to what you used to look.
But it's not harming you in any way, right?
It's not harming you, it's just an addiction that, okay, I can look this good.
But
so then
kind of addiction.
Good kind of addiction, not in a bad way, of course. But then again, I would specify that go to a person who's going to understand that whether you need this or not. It shouldn't be like, oh, she's gotten it, so I should also go for it. It should be individual. It should be according to your natural features. It should be like what you expect out of this.
Have you ever come across anyone like where a client comes to and you're like, "Bus up, now don't do all of this"?
I mean, many times. I mean, suppose somebody has come to me and I would say she was in her 40s and she's just come to me and she's telling me, listen, I want to get rid of this fat here, and I want to get little structure here. Then I had to make her understand that, listen, your face structure naturally is like this. I mean, I don't want to promise you something that is undesirable. She's showing me an actress picture and she's like, oh, can I just look like her? So please, this is like a big no. I mean, you cannot be like, okay, can I just become somebody else? I'm not doing a plastic surgery here where I'm just gonna make you look somebody else. Whatever you have, naturally, I can just enhance it. It's not like, okay, this jawline can work for you. So I can just tell you with what naturally your features are and how I can enhance that using the procedures what I have.
So it was, honestly, I think like for me.
So sometimes there's like a lot of surgeries that is involved to get the desired facelift, and people think, okay, no, I can just get this done through injectables, which I would say again, people are fooling you, or if you're just investing your time and money on the wrong professional, where they're misleading you with.
Okay, so I think this was very important because I think there's a lot of confusion between Botox and fillers, because I think every day you open your Instagram and you're seeing people are getting this, people are getting that, and there are a lot of, I don't know what exactly their profession is, but a lot of those reels are also circulating where they'll put a certain celebrity in front of you and they'll tell ki isne ye kara hai, this is
I know. So I would say, in a way, that is also very educating, that people are educating you that, okay, this was the before and this was the after. So they're getting awareness about how the Botox or a filler is looking on a person, or maybe a celebrity you have been seeing through years, and you can actually spot the difference. But there are people who come to me and say, oh, I don't want to start the injectables, I'm very scared of the needles and I'm needle phobic and I don't want to start this as of now. So there are other skin tightening lasers, so like ULT therapy is there's Thermage, there's HIFU. I would say HIFU is something that's really picking up.
Tell us more about that.
So HIFU is the high intensity ultrasound, focused ultrasound, where you just probably need around one session in 6 months time, and we are building collagen through the heat energy in that.
Okay.
So if you know that collagen is the main structure for your skin, it's the main protein. Okay, so as we start aging, I would say from 20s, we start shedding our collagen naturally. So we should always work on building the collagen for the skin, and these are some lasers where there's no downtime, there's minimal heat needed or minimal time needed. So you can just start with that if you don't want to start with the injectables as of now.
So do you think these collagen creams, they work?
I mean, few of them, yes. But again, as I've told you, it's beauty is inside out. It's just not what you apply. It's also what you eat. Also your hormones. Also like a lot of factors that, is a concaction. There's also like a lot of things that's gonna accumulate and give the desired skin you're looking for.
Okay, Vaishali, I think thank you so much for this session. We've had an enlightening session, and I really believe that there's a lot of misinformation or not the right information that people have regarding skin aesthetics, and thank you so much for sharing all that with us. It was really a pleasure having you.
Thank you, Akshi, and it was really nice for all of you.
And we're so happy that you're doing it now.
But thanks for having me, and it's really inspiring for me as well that all the moms around me, they all are working and that they're so successful. So this all inspires me that being a mom is just a new journey that has begun in your life, where a lot of things, like you've come back as a stronger person.
Definitely.
Yeah.
Thank you so much. So now let's quickly get into a fun, quick rapid fire round.
Sure.
I'll just ask you this or that. Okay. So, physical sunscreen or chemical sunscreen?
I would say physical.
Physical?
More safer.
Okay. Clay mask or sheet mask?
I would say depends. Or for oily skin, I would say clay. And for somebody who has a dehydrated or a dry skin, I would say sheet mask.
Then Indian skincare or Korean skincare?
Indian, of course. We all are Indians. Indian skincare.
So we know a lot of these celebrities are doing.
And I would say Indian, Korean, there's nothing like it. It's more towards your personal skin. What's your skin type? So go according to that.
Okay. So what do you think got the better procedure done? Sushmita Sen or Aishwarya Rai?
I don't want to comment on that.
Okay. Then next, hyaluronic acid or niacinamide?
I would say hyaluronic acid.
Hyaluronic acid, like an everyday serum.
Yeah. Even niacinamide for that reason could be an everyday serum. Depends on if you have pores and you're working on a poreless skin, then you can go for a niacinamide. If you're working on the hydration part, then go for a hyaluronic acid serum.
So last one, Botox or fillers?
Again, a very personalized thing. But if I've not started anything yet, I'm 32, a new mother. Maybe if I want to start, I would start with a filler? For me. Yeah.
Thank you so much, Vaishali.
Thanks for having me here. Thank you so much. Thank you.